Live from our 7 Tasmania studios, your nightly news with Kim Miller begins now.
Good evening, everyone. An investigation has shed light on how the coronavirus outbreak began at the Northwest Regional Hospital and why it spread so rapidly. And even as the results were released today, we found out yet another life was lost because of the outbreak. To take us through the day's developments, we're joined live now by reporter Michelle Wisby. Good evening, Michelle. Now, what do we know about this latest death firstly?
Kim, an 86-year-old woman from the Northwest has died. She's the 11th death as part of this outbreak. Overnight, we also learnt there had been only one additional case of the coronavirus, a healthcare worker also from the Northwest. Now, as you mentioned, today the government released a report into this hospital outbreak that explains how the virus spread through our hospitals and changes we can stop something similar happening again. In a matter of days, this hospital became the epicentre of Northwest Tasmania's deadly coronavirus outbreak. And today we found out just how it all started. Patients off the ill-fated Ruby Princess cruise ship deemed ground zero.
Most likely, the Ruby Princess is the root cause of our problems on the Northwest Coast.
An initial report confirming the first 2 patients admitted to the Northwest Regional Hospital with coronavirus caught it on the ship. They passed it on to a healthcare worker and the disease spread. On the wards, 22 patients were infected.
By the time the first cases of infection amongst healthcare workers were diagnosed, that there was already reasonably well-established person-to-person transmission.
We may never be in a position to identify a single specific point of transmission.
This graph shows how quickly the virus spread around the hospital, peaking on April 10. Then the hospital was shut down.
Quarantining staff and patients and the closure of the hospital were associated with a rapid reduction in the number of new cases.
The report found 20% of infected healthcare staff had worked while they had symptoms.
They generally didn't know that they were experiencing coronavirus because they almost universally had very mild symptoms.
People come to work when they feel they must because they don't want to let their staff, their colleagues down or their patients down. We need to work to address this.
It found the spread may have been magnified by regular staff gatherings like handovers in confined spaces at the hospital. Another factor, the transfer of patients and movement of staff between health facilities. But the Premier has issued a warning.
Don't use this report to blame people. Use this report to ensure that we learn.
Backing up police findings, the report said there's no evidence of social gatherings outside the workplace. But in the fallout of the rumours, there's already been incidents of staff being abused in their community.
I've been in receipt of some very troubling and disturbing emails indicating some of the negative treatment.
The report now calls for change, saying we need to strengthen social distancing in hospitals, screen all people when they enter facilities and reduce staff and patient movements between hospitals. Some have already been implemented,
including enhanced staff screening, improved PPE training and communication for our staff, and clarifying return to work processes.
We cannot overlook the possibility that another outbreak may occur in future in a Tasmanian healthcare setting.
The government promised a more comprehensive report and independent investigation in the future, shedding a light on a pandemic that's already claimed 12 lives in our state.
Now, further to this, Michelle, what's been the reaction to the investigation?
Kim, the report has been welcome, but there are still a lot of unanswered questions, especially around the handling of the Ruby Princess. The Premier has warned we may never know exact point the disease was spread, but his political opponents say they want more details, especially around the use of protective equipment for our healthcare workers. There's even been a suggestion of a royal commission into the crisis.
The Ruby Princess back in the spotlight. Tasmania's Northwest outbreak linked to the virus-stricken ship. Now people want answers.
I don't think Northwest Coasters are actually putting any blame on our emergency service workers, that's for sure, our nurses, our doctors or anything else. It's more what happened with the Ruby Princess.
To allow the Ruby Princess to dock and disembark passengers after the ban on cruise ships was put in place without testing is in fact very likely to blame for this outbreak.
But questions remain over exactly how the virus first spread within the BURNIE hospital.
There's a gap there. there's a weakness there. Something happened at that hospital, something wasn't followed, and we need to know what that was.
Infection control guidelines and certainly the environment in which staff are working in are certainly areas that need to be fully addressed to ensure that this doesn't happen again.
It wasn't demonstrated that there was any failure of PPE. We are not the first place in the world that's had an outbreak in a hospital, and we won't be the last.
Now Labor is calling for a royal commission.
It is clear that there were multiple systemic failures that led to this outbreak, including patients being transferred between the North West Regional Hospital and the Mersey Community Hospital.
In terms of the health system, I reject the fact that it wasn't resourced or ready for this.
LETITIA Wallace, 7 Tasmania News.
Meanwhile, a person has been cleared of coronavirus in the state's south after they initially returned an unclear test result. There was confusion when one test result came back inconclusive and needed further assessment. Health authorities have now confirmed a further test yesterday came back negative. The person and their close contacts have now been allowed to leave quarantine. The state's leaders returned to a fiery sitting of Parliament today, discussing measures to help slowly ease restrictions. Premier Peter Gutwein delivering his recovery plan for Tasmania, focusing on increased testing, tracing and rapid response.
A recalled Parliament sitting a little differently. Gloves off as Labor questions the source of the discredited illegal dinner party claim.
Can you explain how the Prime Minister and the CMO got this information and why they felt confident enough to spread it nationally and internationally?
Why are you playing politics with this? What I'm concerned about is doing my damnedest to save lives. Yeah. That's what I'm interested in on this side of the House. And to be frank, that question that you've just asked doesn't do one bit to save lives.
Frustrations boiling over when questioned over local job losses.
Premier, what have you done to advocate for these casual workers to ensure that they do not miss out on crucial support?
I would like no one to have lost their job. I would like no business to have shut. But unfortunately, in this place, we had to do that. We have exercised our state balance sheet and we have done everything that we possibly can.
Parliament recalled after a month-long suspension. On the government's agenda, its recovery plan.
More testing, more tracing, enhanced rapid response capabilities and COVID-safe workplace, public space and meeting place plans.
Also including rapid response teams to be quickly stood up in case of any future outbreaks, with the initiatives aiming to slowly return Tasmania to normal.
Once our safeguards are in place, we can gradually ease the current restrictions as much as we can without risking a disastrous outbreak of the virus this winter.
Measures for Tasmanian businesses today, payroll tax to be waived on JobKeeper payments from the federal government.
Keeping the full amount of funds in the hands of those eligible businesses and their employees, and to take away any concern or potential for a disincentive to happen in the system.
Not for 1 second questioned our ability to get through this, and I know that we will, together, be able to do this. But I do think it will require more support than what's been outlined today.
Parliament sits again next Thursday. Ruby COMMANE, 7 Tasmania News.
Our Defence Force personnel are finally flying home after successfully reopening the North West Regional Hospital. But as healthcare staff return to work, Federal Forces warn outbreaks similar to ours could occur anywhere in Australia.
Living in unprecedented times, Federal Forces undertaking an unprecedented task, taking over 2 of our state's hospitals during an outbreak. Less than 3 weeks on, AUSMAT and ADF personnel are handing back the hospitals and flying out of Tasmania.
It's quite unusual, and we certainly would never have expected to be responding on home soil. Certainly from the Australian Defence Force and the AUSMAT point of view, we normally work together overseas. It's quite unusual for us to be doing that here at home.
The team saw more than 450 patients during its time in charge. Personnel have been working 12 hours a day to keep the emergency department running, while 1,000 staff members were in quarantine.
The AUSMAT and the ADF team came in some fairly challenging circumstances at the beginning of the deployment. I mean, it's been a real privilege for us to be able to deploy here and to support the Tasmanian government, but I'm especially proud of the work that's been done by the AUSMAT supported by the ADF team.
We're very grateful for what AUSMAT has done on the North West Coast, and I think all the residents of the greater North West Coast are very appreciative of their efforts, and today's the handing down by the Premier of the report as well, highlighted what needs to happen into the future as well.
But as we say goodbye to the team that turned our hospitals around, they stand by ready for the next call.
This isn't the first outbreak that we've seen during this pandemic, and it certainly won't be the last that we've seen nationally.
Elizabeth O'Neill, 7 Tasmania News.
The first of 4 coronavirus respiratory clinics run by GPs has opened in Devonport. We've been given a behind-the-scenes look at how the facility operates and what practices are in place to keep everyone safe.
This is the first look inside a coronavirus testing clinic.
Alright, so I'm going to do this nasopharyngeal swab today.
The GP-led facility opened on Friday in Devonport.
We've had a pretty good take-up, really. These clinics have the capacity to do further assessment on the patient and treatment if necessary.
Patients have their temperature checked on arrival and are handed a face mask before consultation and swab.
What is it that's brought you in today?
I just had some flu symptoms, sore throat, runny nose.
We would encourage anybody with even very mild symptoms to come in. Something as simple as a scratch in your throat would be enough for us to want you to come in and be tested.
The clinics are part of the federal government's $2.4 billion health package. Strict infection control measures are in place.
A lot of work has been done to make them very safe for both the patients and the staff who are coming in here. There's a secure supply of PPE for the staff, and the physical infrastructure of the clinic is quite different.
GPs, nurses and others have been going through extensive testing and support to ensure that the most up-to-date and appropriate techniques to manage hygiene are applied in these clinics.
This is the first of 4 respiratory clinics to open around the state. Clinicians have been carrying out 30 tests a day so far, but they're hoping for around 120. Test results take between 2 to 4 days to come back.
The majority of samples that we take here are going off to a private lab in Brisbane, and they're for people who have symptoms but no contact with anybody who had COVID.
Those at a higher risk will have their samples sent to the Royal Hobart Hospital. Residents don't need a referral unlike other testing clinics around the state, but bookings are essential. A respiratory clinic is due to open in St Helens tomorrow, with another one in Hobart and Launceston to open their doors on Monday. LETITIA, WALLACE, 7 Tasmania News.
A new report says the government's stimulus package has made housing more affordable for Australians who were struggling to pay rent before the pandemic. Prior to the health crisis, an Anglicare report found just 3% of all properties for rent in Australia were affordable and appropriate for households on government payments. But the increase in welfare for some recipients has seen thousands of properties now become affordable. The housing situation has been particularly bad for single people, with less than 1% of rental properties within reach. A 20-year-old man has pleaded not guilty to several charges relating to a recent alleged confrontation with police. John Seether was allegedly armed with a knife on a Montrose street during the incident. Today pleading not guilty to 4 counts of aggravated assault and 1 count of attempted armed robbery. The case has been sent to the Supreme Court to be heard in June. Still on court matters, and a 25-year-old has become the 3rd person charged over a home invasion at Caveside on Sunday morning. The Perth woman is accused of breaking into an elderly woman's home and stealing valuables. She's been charged with aggravated burglary and stealing and will appear in the Launceston Magistrates Court in August. Targa Tasmania will be held a month earlier from 2022. The Tarmac Classic will remain in its traditional April time slot next year before swapping to a March start date, and it will remain in March until 2027. Pure Foods Tasmania has made its debut on the ASX after changing its name from Bunge Corporation. The food company raised $3.5 million, more than initially expected, to support the growth of the business as well as future acquisitions. The business says it has not been adversely impacted by the pandemic. It finished the day's trading session higher. Tasmanian fast bowler Jackson Bird has capped off a stellar season, honoured as the Tigers' best one-day and Sheffield Shield player. The quick claimed nearly 40 wickets in both competitions. 33-year-old believes his strong red ball form could pave the way for a return to the Test side.
I've been pretty consistent in Shield cricket the last my whole career really. So I think last year was no different. So the selectors know what I can do really.
Bird says the Tigers' purple patch of form at the end of last season will give the side confidence heading into this year's campaign.
Good evening. Temperatures up to 6 degrees below average today. Hobart 16, the northern centres all 15 degrees. Cape Sorel our top 17, Smithton and Strahan 16, Low Head, Grove, Ouse and King Island 15, Friendly Beaches 14 today and Flinders Island 13 degrees. The rain band cleared the east today before low-level cloud moved mainly over the north and west. Flinders Island our top rainfall to 3 p.m. of 6 millimetres. Of course plenty overnight as well elsewhere over the mountains. The large frontal cloud moved over the eastern states today, wrapping back to a low pressure zone. Cool winds produced cloud over the southern coastline of the mainland. Tomorrow the complex low lingers over our region as cold fronts pass the southeast of the nation. A high moves in too from the west. The winds northwest to southwest at 20 to 30 knots, reaching up to 40 knots offshore over the north. Variable winds elsewhere until 20 to 30 knots southwesterlies develop over the west. Gale warning from Low Rocky Point to St Helens Point. A strong wind warning for Bank Strait, Franklin Sound and the southwest lakes. And a warning to sheep graziers for most grazing districts. Skinny temperatures tomorrow, just 14 for Hobart, Huonville and Campania, all expecting a shower or two. Same for Launceston, a shower or two, 13 the top, 13 for Devonport, Georgetown 13. Burnie tomorrow, a top of 13 with a shower or two. Showers increasing for Strahan, 12 the high and 13 for Wynyard. And a possible shower for St Helens, 13 the top, 15 for Swansea, a shower for Port Arthur, 14 the maximum. Saturday, showers over the west and north, increasing, a shower or two elsewhere. St Helens, a cloudy 14. Partly cloudy on Sunday with showers over the west, central and south. And on Monday, a morning shower over the southeast, fine for most, apart from a shower over the west and far south. Sunny and 25 in Perth, showers and a cool day in Adelaide, even colder in Melbourne. And if you reckon it's cold here, take a look at Canberra, 1 tonight and a top of just 7 tomorrow. Brisbane, however, sunny and 24. And it's currently partly cloudy. Hobart on 11 degrees, Launceston 11 as well, and Devonport showery, Kim, and 12.
Okay, thank you very much, Murph. Now, finally tonight, we do have some breaking news that's just come in. Tasmania has recorded its 13th death linked to coronavirus. It's an 86-year-old woman who has died at the Mersey Community Hospital. We'll have more details in our bulletin tomorrow night. That's all your news for now. I'll be back later with updates. Thanks for joining us. Good night.